Somebody. All right, we will call the December 19th, 2024 Board of Health to order. Any announcements or agenda changes, Monica, that we need to be aware of?
I don't believe so.
Okay. Moving on, is there a motion to approve the consent agenda?
Motion.
Motion, do we have a second? Second, all those in favor, please say aye.
Aye.
Motion carries. Next, we have the just agenda. And under that, we have our regular items. So an update, annual recap. I assume Monica, you can do that?
Yeah, so, before we get to that, I did want to just briefly talk about the meeting schedule for next year. So we, according to the state criteria, the goal is to meet in January, elect officers at that time, April, July, and October. So I'm hoping that we can get those meetings on the books for everybody so that they're on your calendar, blocked out on your time, so that you're aware of those. And then my suggestion, and please feel free to tell me if that's not a good one, is to just hold the same time every month, just in case, like we did this year, we need to have an extra one, or for some reason it's conflicting with a holiday or something like that, we need to move something. And what we have been doing was the fourth Thursdays at 11 a.m. So if that still is something that works for the group, we could continue with that. Or
Thursday.
fourth Thursday at 11 was what we had scheduled out this year. And I know part of that was for some of the position schedules that, but I don't know if that's worth moving, or if the board wants to make any changes to that schedule. If you need to, we don't have to discuss it here. You could send some requests to Carrie, but we'll try to get at least the 4 required ones as a confirmed time on your books, and then whatever that date, or Thursday at 11 or whatever, we'll have those holds for the rest of the year as well.
Anybody have any objections to just remaining consistent for the time being?
No.
Okay, we'll stick with that, and if anybody has it, just let Carrie know. All right, Monica. Next.
Okay, so I thought I would just recap. This is my favorite time of year as we start ending the year and heading into next year, getting ready to produce our annual report. It's hard getting through a year and you forget all the things that you've done, and then at the end it's so helpful to kind of summarize them and say, oh my gosh, I can't believe that we did all of these things. So just as a reminder, we moved our office from the fire department to Technology Drive. Our Health First Indiana funds, our first allocation came in 2024. So we've been using those funding and really working to prepare for clinical billing, which is now implemented. So we have started billing. We are having a few hiccups anticipated with various insurance companies. So almost all of our board members work with insurance companies, and you know how that might be a little bumpy at first, but we have put that into action and we have started billing. Our Culture of Health ambassador managed the Guys Half Marathon this past year and increased enrollment significantly and exceeded all of those goals. She's also been working, I think, on the trails with our planning and zoning department, as well as implementing a passive wellness wander mental health kind of exhibit that moves from park to park every month. We had our second year of Credible Mind, and we have more than doubled, I think, the total use of Credible Mind between the 2 years. We've had almost 20,000 sessions and almost 9,000 unique users each year. So, or more than 9,000 this year, I think. So that's been really, really good. I don't know if any of you heard, but I think it was in the current that Hamilton County Health Department has also purchased Credible Mind and just recently implemented it. We also have hosted a few new mental health events this year. One of them was our International Survivors of Suicide Loss Day, which was really, really good, I think, for the community. We held that in November. And then we also held a filmmaker who is a Fishers High School graduate and is now making films out of California, produced a film called Sometimes I Imagine Your Funeral that was really about his sister's overdose and what it was like being a sibling in that relationship. And that happened here in Fishers some years ago. So he had a big screening that we facilitated at the library. that was very well attended. We really ran out of room. There were over 90 people in the room. And then he's, I think, gotten several offers from that to screen it at various places in the community as well. He screened it down in Indy, and it's been very well received, as well as some of our activities like Hope for Happiness and Club Day and Serve Your Community Day that we facilitated at the Farmers Market. Those are some other events that we posted. We had our second year of the Teen Public Health Academy. We had a 2.0 version. And Casey, our health educator, was also able to present that at NACHO, which is the National Association of City and County Health Officials, and got a lot of good response from that. A lot of the kids, we've had our first kids actually go on to study public health, so that's kind of exciting. The kids really like it. The 2.0 was for kids that had been the year before and wanted more. So they were able to do some ride-alongs and shadows and things, which was pretty cool. So we're looking forward to doing that again next year. We also, had some adventures with bats. You can see a photo there. And with our board member. We've been working on preparedness and reunification plans with our emergency response teams in public safety. We have had not totally declared outbreaks, but a few events where we've had to notify community of circulating infectious diseases, specifically related to pertussis. So we've had a few notifications go out in different settings for pertussis. The country is seeing increased rates of pertussis this year. So we're definitely seeing that locally as well. And then we've had a few adventures in trying to determine where septic leaks are coming from, which has also been just a new experience for us as a health department. And then we've really implemented our fall prevention program. We had in addition to doing in-home assessments and community and risk assessments with our community health advocates, we have had some classes with Purdue Extension Office offering the Matter of Balance classes for fall prevention, which has been very well received. We also have had our social worker has been offering mental health supports, specifically in coordination with public safety, doing follow-up on all of the emergency detentions, and then offering guidance and building program and support in that area. We have implemented what I am calling a comprehensive health education curriculum through the schools. So we are in front of almost every almost every grade at this point in HSC schools, and then with a few touch points in other schools as well, offering a health curriculum. So for example, kindergartners all receive classes on hand washing. So basic building blocks, right? Third graders, because it's a heavy testing year, they get kind of stress relief, anxiety management, kind of tips and tricks. It's been really interesting because this is the second year for some of the students to see our health educator. And so, they're able to remember and reply with what they learned the year before, and they're starting to really recognize her. Our goal for next year is just to add second grade, because that's the only grade under high school that we're missing. So that's pretty cool. Josh has completed a secondary data analysis of a lot of our community health indicators to work towards completion of the community health assessment. So that's provided some really valuable data. And then we have awarded our first community grants in this year. So that was something new for us this year. So part of that was $50,000 of the Health First Indiana funds. We awarded to Trinity Free Clinic, if you recall, Shepherd Center of Hamilton County, and BPC Hamilton County. We also implemented our club grant program for student-led efforts to improve health and wellness from clubs. Any club in any area school, if it's a school-sanctioned club, can apply for one of those club grants. And we have awarded our first 3, and I think we'll hopefully soon be awarding 2 more from applications that we've received. So those are all pretty exciting. So I'm really proud of the work that we've done this year. It continues to amaze me how many things we can chalk up every year. Does anybody have any questions about any of those things? Welcome.
Sorry, I went to the wrong meeting.
Well, I think it's, if you recall, I think at the outset of this year, our goals were to get the clinic up and operational and get to billing, and I think we've achieved that. We also really this year in earnest implemented our social work program, and the stats coming off of that are pretty incredible, actually, and the anecdotal stories are powerful of what they're able to do with a lot of these individuals. So that's another program that really wasn't there before this year. So we are adding these building blocks that I think are impactful and meaningful to the community. So I think it was a productive year. Can you speak to two things? The food code, the state food code, is that? Okay. That's what's next. Okay. So that wasn't necessarily, the other, so we'll talk about that in a second then.
Yep.
And then, the other question I had for you is accreditation.
Uh-huh.
Is that on here as well?
Yep.
Okay.
Yeah, so looking forward to 2025 and what we're looking at next and up ahead. So Health First Indiana, that legislative funding coming from the state, the amount that we're receiving will approximately double. Every county in the state is now opted in and will be receiving funds. So we're looking forward to that. The bulk of the additional funding, I would say, aside from moving some positions in line with kind of grant objectives and goals, and folks coming off of temporary grants and onto this funding, is really to increase the clinic offerings. So it's a heavy focus on clinical services and health education. So aside from the funding that we're anticipating coming, this is a budgetary session for the legislature, so we will be watching that pretty closely. Our funding goes through the end of 2025, so through 2025, we're good because they set it on a calendar year and not a state funding year. But the legislature will be deciding this year whether and how that's continued in years forward. So we'll be tracking that. We also submitted key performance indicators, and I'll discuss those here in a second as far as what those priority areas that we submitted are. That's a requirement for this funding. We've been working on Core Tracker, which tracks all of our activities. So the requirements that go along with this funding are acted much like a grant deliverable, even though it's not a grant, it's an appropriation. So we've been kind of working through those processes, and the state's been kind of figuring out how to do that and implement it successfully. We are really looking towards accreditation readiness. So Laura, our very brave person that has been tackling the medical billing world, as we kind of get that sorted through and get that smooth, then her focus will shift in part to kind of accreditation organization. It's a heavy amount of document collection and making sure that we have processes in place like quality improvement teams and performance management structures and things like that. But then before we apply, it also requires the completion of a community health assessment, a community health improvement plan, and a strategic plan. So all of those, so this year we hope to be kind of getting the document together, making sure we have processes in place, and putting the finishing touches on the community health assessment, working towards that improvement plan and that strategic plan. So in order to really complete those in alignment with the accreditation standards, we need to form a steering committee. So we have those letters drafted and expectations drafted. It requires that we have partnerships with community members and community groups as part of that steering committee for that process. We have a survey that's drafted and almost ready to be distributed to residents. Josh has been working on that and kind of testing and vetting it and understanding the readability of it, et cetera, as well as the benchmarks that we need to hit in order to be able to analyze it well by different demographic categories. So I think we'll easily be able to achieve that. We're in process and have a meeting later today to discuss focus groups that we'll need to hold and get organized. And then we work on the kind of overarching planning of all of those activities. My hope is that these focus groups and the steering committee will have a couple of touch points along the way, because not only for the assessment, but it'll roll into that improvement plan, which is really the more fun part of after you set the priorities, what do you get to do about it? And what is the major activities and initiatives that need to, that residents want to see, or that some of these community partners would like to see us do, and really kind of flesh out those gaps. So that's kind of how we're approaching that part of it. And then my hope is also to possibly convene a resident advisory board to really make sure that we have that voice of the resident lifted up, and part of that, which is best practice and part of the hopes for that accreditation process. Really as kind of a sense check and just an opportunity to make sure that residents are involved in the process. And then the expansion of clinical services that we've talked about. So we've been working all year, in addition to the billing, on creating the standing orders, the processes, the policies around some of these services that we hope to roll out. So this is a list of some of the services that we've been preparing, and then open to ideas for more, and then hoping that some of these community health improvement planning and resident advisory board can inform that a little bit further to make sure that those are services that people are looking for.
Does the travel vaccines, is that insurance won't cover that? Or-
Insurance doesn't cover that, so that's payment out of pocket, and they won't cover it for anybody, so that'll be pay out of pocket.
And that's offered now, right?
It's not offered yet, so I think where we're at with that is Dr. Robertson, as the medical director consultant for the health department, will need to take a yellow fever vaccine class. It has to be, we can only order it under a physician license through the state. They manage all of that. So that's on her radar. She hopes to complete that, I believe, this month, as soon as this month, and if not, next month. But that's a requirement to receive yellow fever vaccine. So that's kind of our primary thing that is the limiting factor right now. And then we've looked, but our vaccines program, they've looked into all the ways of operating this. There are some very good tools that help guide us through that. So we're going to plan to purchase one of those tools for the nurses and providers to make sure that we are giving the best possible advice on this, as it's a little bit of a learning area for us.
With the amount of international travel from residents, I would think this would be a pretty popular amenity.
We think so too. Yes.
Is that you have to, some of these clinics are not very close, and they have.
Yeah, they're not, yeah. I know that IU has one down in Indy, and there's a private practice in Nora, and then Tippecanoe Health Department, Monroe County have them, but Allen County, but those are pretty far away. So we think that we're well situated to be able to offer that service.
That'd be great.
Yeah. Yes.
Do you really?
Yes.
There's what the typically was, almost just to serve all the students, because we send them,
Oh, sure.
and yeah, so.
Huh.
So looking forward to that. Another potential idea is we're looking at like screenings for cancer detection and things like that. As I just saw that it was just approved that like pap smears can be done, self-collect, which could be a really interesting and valuable service for us to provide. But just different things I'm watching and on the horizon.
So as we bring
Good
on
for us.
all of these services, do we have to come back to the board to set fee structure, or do we
I
provide
think-
guidance? And
I
you
think
guys-
the way we set the fees,
did it already.
the way that we set the fee structure at the last meeting, and which I believe we have already had council approval for, we've
Okay.
already set all that. And what we did was we primarily tagged everything to Medicare, Medicaid
Oh, okay,
rates.
gotcha.
So it's at a very low cost.
got a
So
flexible
insured folks will have the
framework
low cost benefit. We're not hoping to recapture all of our money, like,
Right.
so we're not looking to even break even on cost. So I think because we tied it to those rates, we shouldn't have to go
Gotcha.
through approval for each and every service. Yeah. Then that was the hope with doing it that way.
Yeah, right.
And then community-based education, so I talked about in previous meetings, adding another health educator. We have made an offer, and that offer has been accepted, and that person starts January 13th. So we're definitely looking forward to that person starting. We're very excited and think that they have a really complementary skill set to our current health educator that will really allow us to expand our health education offerings for the community specifically. We also have had other staff getting trained in offerings. For example, our health educator has received training in Stepping On, which is a different fall prevention program. It's a class-based program that we can enroll residents in because those fall prevention classes have been really popular. We also had our pool inspector has been trained to offer the certified pool inspector or certified pool operator training that we require for pools. So just like we offer ServSafe for restaurant operators, we can now offer certified pool operator classes, which would be really good. That training was ridiculously intense. He had to travel for it, studied very, very hard
Be a pool operator?
to be a trainer,
Trainer of the pool
to
operator.
officially make sure that other people can be a certified pool operator. It was like a 4-day long out of state training that
On the,
he was studying every night until 10 p.m. for.
on the early child, or on the education and training certification, like we know, we do Safe Serve and we do all these other things.
Yep.
This crisis around early childhood education where people are having difficulty finding staff and the cost of childhood or early childhood care is really expensive. Is there anything that educators that are in preschools or childcare facilities require from like an education or training perspective that we could offer in our public health course? Like, I don't know what is required. Like, I don't know if they do any kind of a safety or health perspective that they're required to get.
Probably CPR, stuff like that would be my guess, which we've had one person trained to be able to offer that. And we're getting one of our nurses trained as well to be able to offer that, our school liaison nurse.
Yeah, I just think about like.
So usually it's health related stuff. I hear what you're saying. I'm not sure. People usually come to us for like, we could do like the babysitting classes, right? Safe sitter program, but that's not really for early childhood education.
I'm just thinking anything we could help supplement at cost, trainings or whatever.
Because we can absolutely, they still on the books, they require TB testing. So those are easy things that we can support. It's not recommended by the CDC, but our state law still requires that all people in early childhood have to get TB tested. CPR class. So there are those kinds of easy supplemental trainings that I think make a lot of sense for us to offer as far as what it's required to be an educator in that space. I'm not familiar with those requirements. Yes.
The digital offerings, I think that's really neat. I mean, everything from newborn to elderly parents, could you talk about that?
So it's been Casey's dream already to kind of take some of the content that she delivers digitally in two different ways. One, it could be for parents and small, like bite-sized things, like quick trainings, just to expand the reach of some of the education programming, and also something that teachers could take and grab and use in their classes if they wanted to, fill a space with a specific curriculum or specific component. And then our new health educator actually has a lot of experience with website management for health education. So that's one of the areas where we think like, okay, there's a lot of this skill set will really help to augment and amplify what we're already wanting to do. Casey's just been so busy, really getting into the schools, which she was charged to do, that she's out of time, frankly.
Like a black hole.
So we're really excited about what else we can offer. Another potential offering that we've been talking about is like a college ready kit and class for kids that are about to go off to college to have real discussions about how to navigate tricky situations when it comes to alcohol or sex or some of those topics that they may be encountering for the first time, and supplies if needed.
Both a lot of time for that conversation.
Yeah. And this person has experience as a college in a college setting, working with that group. So that could be really beneficial, just as an example of some of the community offerings. But we're really excited to see how that can expand over the next year.
It'd be really nice if we could be a resource, newborn parents. Instead of Googling everything, I'll go to the health department and they've got something.
It would help your job, yeah. So maybe you could provide us with
A few videos from you might be helpful.
priority topics also.
That'd be good.
And we can work on that. yeah, safe sleep, definitely. So,
that
very,
still a
very
big
exciting about
challenge?
Absolutely. Absolutely. And it's to the point sometimes, if you don't ask, they won't tell.
Yeah.
Yeah.
Well, I think some of our worst calls of all time are when we end up at that house
Yeah.
with a mom and a newborn.
They just sleep with parents.
Yeah.
Yeah.
Those are the worst.
Very scary.
From a school health perspective, we're really focused a lot on physical activity and increasing those offerings in different ways. And some examples of that are that we're looking to have a partnership to offer like an open gym time, just as a unscheduled kind of time for the community to come in to a gym and, you know, play with their kids, or kids can play together. So we're working on those kind of policies and criteria. We've secured the space. We're aware of the cost. It'll be pretty low cost, and just managing that is going to start on Sunday afternoons. So just as an additional third space during the winter, especially because a lot of these folks don't. And there's just that we'd like to see more offerings in that space. So and then nutrition, we have a couple of different things we're working on. I'm going to talk about it in a minute, just to, and for your consideration, and would love your input on. So I'll talk about those in a second, but really looking at student nutrition. And then related to the new food code standards, that new food code should be possibly getting signed soon. It's been up for public comment, and they're anticipating putting it on the governor's desk, I think. So we're looking at that possibly as early as the beginning of 2025, but it is state dependent. So we're waiting on that. We've been preparing all year, and we've already crosswalked all of our standards into our grading scale. I think we've talked about that before. And so just when we get the go ahead, we'll basically have to stop our inspections for about a week as we get that reprogrammed into our inspection software. But we've had all the crosswalk done. We just need the verification of making sure that everything went through. What this new update does is that it takes the state has had the same standards for food inspections for, I don't know, 15-ish years. So this updates it and makes it in line with the 2022 FDA standards. And I think the intention is to tag it to the FDA standards. So when the FDA standards are updated, then it will automatically be updated, possibly by reference. I could be wrong. But we have been working very hard over the last 2 years on an FDA standardization grant. So we're very familiar with these standards. We've been working all of our inspectors through this process. So they're very, very comfortable with all of these changes. But one of the things that is going to be different for all the operators across the state is that it does change to those risk-based inspections, which I've talked about before, which really says that you're going to inspect places more if they are doing higher risk activities, such as basically cooking seafood, cooking meats, things like that, versus if it's a coffee shop or
So do we set-
something that doesn't
do
have
we
a
set
lot of
that
things.
here?
They said that.
They said that, we
They
just
said
have to
that.
adhere to it.
Yeah.
Okay.
Yep. And then the second thing that we're hearing might actually be close, that was passed a couple of years ago, is being able to offer all vital records to all Hoosiers. So instead of only being able to offer birth and death certificates to folks that were born or died in Fishers, we can offer them to any person who was born in Indiana or died in Indiana. So we're really looking forward to be able to expand that service. The state's just been working through some procedural things for a while, but we're hearing that they may be close to actually giving us a go ahead to do that. So.
Well, and regardless of whether that happens or not, just IU opening next
Yes.
fall with their
We're going to increase
women's
volume
health,
with
you're
that.
gonna have.
Yep.
I think there's 12 or 14 birthing rooms in
I
there.
thought it was 16, but yeah, it's a
Maybe.
lot. Yeah.
It's a lot.
The governor's office is seriously thinking about moving EMS on the public health.
Oh, wow.
Just, do you foresee any challenges with that?
I don't know. I don't know what, I don't know what that would mean for
Yeah.
us.
County operates that way, so the Clark County Health Department is in
Sorry.
charge, Clark County Health Department is in charge of the EMS
Mhm.
there, so.
I think it really has more to do with state bureaucracy than it does with us.
Yeah, I don't know that necessarily needs to change at the municipal level, but I think that oversight and function, I think the state, is it the state EMS director, is he
Correct,
the, one of the EMS guys is a health officer in 2 counties, I think.
Oh,
Yeah. Uh-huh. And then finally, the community center should be up and finished at the end of 2025, and we anticipate moving our offices again into that space. So it should be pretty exciting to be in that space. And then just to move, well, first of all, I guess, were there any questions about any of those plans? No. So the Health First Indiana required that we submit KPIs or key performance indicators on all of the core health areas that were outlined in the state code. So we submitted these KPIs based on, we didn't have to submit one KPI for each core service area. We were required to submit a minimum number of KPIs. We based these on where we could make the biggest impact according to the data analysis that Josh has been working on. Tobacco prevention and cessation, we don't have county level data for youth and tobacco prevention. City level data. We don't have access to any city level data. So this is our one, what I would call a process metric, where we're just saying, okay, how much can we do? So we want to increase the percentage of 7th and 8th graders that are getting Catch My Breath training, which is anti-vaping education, significantly. So part of that health curriculum that we're going through, Casey's already doing that. And we're really excited to see where that leads and if it helps prevent vaping in our kids. Chronic disease, hypercholesterolemia, obesity, and high blood pressure are over 25%. So hypercholesterolemia, I picked that one just because it was the highest percentage. So I figured we had the lowest to go, but they were all, I think, between 25 and 30%. So just really kind of working on kind of physical education and nutrition initiatives in that space. Not physical education, but physical activity and nutrition. Mental health, we continue to look at the case rate by death by suicide. So that's kind of an end stage indicator. That doesn't mean we're not working all the way upstream on those, but we believe that we could potentially decrease that rate. We're looking at that and our substance use rate over 5-year terms because they're not super high, but we believe we can make a significant impact in decreasing those rates. Immunizations, our HPV vaccine completion rates are really low. So this is the area where we can make the biggest improvement. Almost all of the rest of the vaccine completion rates are over 90%, but HPV is much lower. So as far as improvement capabilities, this is the biggest indicator that we could easily hopefully achieve. Maternal child health, really working to, when we conducted the data analysis, really what we're finding is there are some groups that aren't able to access care in the first trimester. And that we know is a big indicator, one of the biggest indicators on the health of the mom and the child going forward. So really working to get that access to care increase. So that's one of the reasons why we want to offer pregnancy tests, because then it will give us that opportunity to intersect with those patients at that point and really help them get connected to care as early as possible. We'll also be able to complete their a Medicaid waiver if needed for presumptive eligibility. So. And then trauma and injury prevention, again, the fall rate. So we think we might be able to decrease the repeat fall rate for those requiring EMS transport by 10% by the end of 2025. So seems kind of ambitious, but I think we can do it. So really focusing in this area on repeat falls. That doesn't mean that we don't have lots of other goals and objectives as well. Like I said, our primary
it's dropping
focus.
already.
It's dropping already?
Mhm.
Great.
It's falling.
It's falls are falling. Any questions about any of those?
Just curious how you came up. Is that something that Indiana comes up with these metrics of 10%, 3%? Or
No, that's based on Josh's data analysis and where we were at. So I have more specific, like, I didn't use the total specific language of from what to what, but he's got all the baselines from that analysis. And so just trying to think like what's realistic and measurable at the city level. So some of the things we can't measure at the city level, for example, the youth vaping rate, because the way that they track, like with the behavioral risk factors, surveillance, you don't even Like, it's just not possible to get that at the city level. We could collect vapes collected at HSC schools. We could try to count those, but I don't know how else to measure that. So some of it's just the measurability and what data points we have access to, and then where we're at currently. So those are based on where we're at currently and like what's a reasonable tweak.
Well, we could really spend a lot of time talking about what's reasonable in terms of time frame of changing
Yeah.
the population's outcome, because
Yeah.
even a year or two is a pretty ambitious
Yes,
goal. of
agreed.
Changing,
Agree.
like suicide reduction in 2 years is, I mean, that could be,
That'll be a 5-year average, so we'll look at 2019 through 2023 and then compare, or I can't remember the overlapping years, but
Do we have access to, I always believe in peeling the onion,
Yeah.
going why? When you go with something like death by suicide,
Mhm.
I'm assuming that there are various reasons why someone would commit suicide.
Yeah,
And if you
so,
go after the majority of it,
so we do sit on a, what's the name of that, SOFR?
suicide overdose fatality review.
Suicide overdose fatality review, which is conducted at the county level. So we sit on that, and the purpose of that is to sort of kind of conduct an, I don't know, a case history of the suicide and what were the factors that led up to it. And then just looking at the method and means that people are using. There's that, and then the demographics, right, where people are completing those suicides. So looking at those and then targeting those populations for outreach to like using Credible Mind and using surveys, and then of course just like a general.
early on, the mental health initiative did a forensic analysis of the last 35 suicides we had in Fishers. The police department had done the kind of preliminary investigation. And what they found was there was like 3 different triggers, and most of these people ended up having a combination of the 3. It was financial issues, relational issues, or health issues. And these people didn't tend to have like chronic mental health issues necessarily. They weren't identified as people that were suffering from schizophrenia or bipolar. It was, I'm in financial trouble and I lost my girlfriend and I decided to drive my car into a bridge. It's like these like instant, the profile of ours were not, I guess the thought is immediately like it's this depressed person that's just sitting around all the time. It was a lot of people that like, it was almost a coping issue, like something happened and that almost made it even more difficult, because how do you intervene in that moment of like despair? And so the only thing we could come up with is if they had better social connections, perhaps they're talking to people around them more. But those situations are just difficult. Like, how do you get in front of that?
So we have focused a lot on social connectedness and combating isolation and loneliness and giving people skills and things for that. And then also some of the community-based education on how to talk to someone who might be suffering, like how to have those conversations. So some of the mental health first aid trainings and PPR trainings, and I think we're looking to offer another one soon as well.
And the more resources you have, the more likely you are to break that unique chain of events that leads to that. So
Right.
that's really good. Josh, question for you, and you probably, not that you're the smartest guy in the room, but close. So as our population increases, is that taken into account in the data analysis
Yeah,
for these KPIs? Okay.
yes, yeah.
That's a great
I always-
question. Because like Falls, I mean, Britton Falls continues to age upwards. So like the idea that we're gonna reduce, even if we just kept Falls at the current number, you might actually be having some success because, I mean, we're just getting older.
Yeah, I always adjust whether it's weighted against age and demographics, but I adjust everything.
On the teaching for the junior high, what prevents that number from being 100%? Right, so we have a lot of educational standards where 100%
of those students.
I'm sorry, what number?
There's 4,000 7th and 8th graders.
Yeah,
And Casey, this is her first full year in class year, they would reach like 38% of them.
Okay.
Part of it is scheduling capacity, part of it is getting agreement to have this K through 12 curriculum that we're in there with as well.
So 90% covers really HSE. We do have some outlying schools as well, so they will have to opt in. And then we just wanted to adjust for any absences.
Well, yeah, it was good. It
But
was,
yeah.
right, you know, in terms of, you talk about some of digital education as well, and, you know, there's things that we know that 100% of our kids get, you know, in terms of educational curriculum and things like that, and so it just seems incredibly important
Really,
to
it's
tobacco
account-
prevention. So it's kind of like, I wouldn't want my kids to be in that 10%, and so that's why I was, I
Just
think there are
accounting
some
for
things
those
that it's okay
private
to be
schools,
100%. yeah.
basically private schools and homeschools.
Got it. Okay,
Homeschool.
Homeschool.
that would do it.
That's the 10%.
There's a fair amount of them.
Yeah.
Yeah.
And it's more, it's growing.
Percent of the.
Yeah.
You did
I'd be the smartest guy in the room. He owns that. He owned it.
3%.
2.3.
It's somewhere around low 2%.
Wow. I would think it's
In
more.
Fishers. Well, I mean, if you
It's
look,
growing though.
yeah, there's 29,000 people under 19, so roughly 33,000 something.
Especially post-COVID, it's increased.
Well, I think there's opportunities there too on the homeschool front, because we're seeing this with the art center that we opened down here, that they need an art curriculum, but if you're homeschooling, you may have a difficult time providing that. And so a lot of homeschool folks are contracting out with the art center to provide those services. So, you know, down the road, could public health supplement whatever curriculum that they can't provide at home?
And there are some of the blended programs where some students are homeschooled for a couple days and then go in to structured learning for a few days that we haven't made that reach yet.
And I'm ignorant to this, but in the homeschool curriculum, isn't there a health component?
Yeah, there would be a requirement, I would think, state requirements,
State
right?
requirement, yeah.
So I don't know if we could be a resource for that or not.
Yeah, that's what, it's just getting the word out probably.
And having the second educator and having digital offerings, right?
Right, yeah, exactly.
Any other questions about KPIs or plans? No. So I wanted to give an update on the grants that we're looking at or awarding, as this has been kind of a process for us. So we are currently, we have applied to the FDA Retail Program Standards Grant Program. I think I have a duplication on program there. But we have been participating in that grant program for a couple of years, and that really will probably hopefully be the first program in Indiana to be standardized is our goal. It's a pretty ambitious goal. There are 9 standards that you have to meet, and you have to receive verification from someone who's already standardized, and there isn't anyone in the state who's standardized. But we've been working through that process, receiving those grants. We're just waiting to hear about next year's grant if we're going to be able to offer it. That allows for training and education and for our health inspectors who have been real champions of this program. They've all completed all of the training that's required to be standardized inspectors, which is like the gold standard. They just need to find an agency that can verify that for them. But just as an example, so like I said, there's 9 standards. We're able to maybe meet 2 a year approximately. This update in the state code will help us meet one of them because that's something that we're dependent on the state code for. So. And then another program that we're considering applying to, we've been having discussions with the schools and with our Ag Park program. There are some USDA Farm to School grant programs available that we really think could help expand offerings that we're already doing for the kids through the agriculture program that is run out of the Ag Park with an HSC teacher, Brooke Daniel, who sees all 2nd graders for learning about growing. And she has, sounds like a lot of big dreams for what more they could be doing. We're exploring several possibilities, including, potentially another greenhouse that could possibly even offer food in the schools that the 2nd graders would be participating in growing. So
We
we'll
just,
see where that goes.
we just had to deal with the Indianapolis Zoo to be feeding the chimpanzees. There's like 17 chimpanzees down at the zoo, and they eat a lot. And so one of them's a rescue, and apparently it was primarily being fed Taco Bell.
Oh, no.
And so now they're like transitioning him to like greens, and He's not in love with the situation.
It's like having a teenager, man.
This just sounds like. It's a lot,
I
man.
have 3 of those.
So,
Chewy, crunchy, salty, gooey.
but the amount of consumption, but actually what is amazing at the agri park is the amount of food you can produce on 4 or 5 acres or 10 acres is incredible. And so there is opportunity for us. It's a manpower issue for sure to get enough people to harvest it and timeliness of it, but every year we double production at the agri park and people use it, yeah. Yeah, but child labor maybe, but we'll get through that. I grew up on a farm, it was fine.
Hard work,
Learning
man.
experience, right?
Hard work and resiliency.
Right.
So those are the ones that we're either have applied to or are looking towards applying to. And then this year, I mentioned the ones that we awarded earlier this year for Trinity Free Clinic, Shepherd Center of Hamilton County, and Breathe Easy Hamilton County. We recently, at the last board meeting, we discussed some additional grant programs for mental health funding or mental health support through our school liaison grant fund. So we did award that $150,000 to HSC Foundation to manage the Project Hope expansion. So that allows for greater mental health services for the kids at HSC schools through that community health network school-based therapy program. We also supported the truancy prevention program, and they've already had, I think, the first classes for that, and they were very well attended. So those are primarily, my understanding is kids that have a lot of anxiety about going to school, like trying to give students and parents the tips and tricks and tools to be able to overcome that anxiety, to be able to actually get to school. And then we have awarded our first 3 club grants. We have a couple more to be awarded, so we're pretty excited about those. So I know that one of them was to offer yoga in middle schools, and another one was in conjunction with the Riley Dance Marathon to offer some health education at that at some of those events or one of those events. And then what am I missing? The third one?
The Do Something Club.
The Do Something
at
Club.
Fisher High School.
So there's a Do Something Club and they go do good
Something.
deeds, basically. It's like a good deed club or something, but it's called the Do Something Club. So they
Acts
were
of
gonna
kindness.
pack, I think they were working with a nursing home to pack meals for the homeless. So they have the
That's
kids doing that out there. So those are the kinds of projects that we're hearing about. We've got a couple more in the hopper that have applied that we'll be communicating with soon, I think.
So just so I understand, that money already went to the foundation and then you approve the
club grants
or the
are,
club is directly with you
the
guys?
club grants go each time they're approved.
Okay, so they come to you and then you give the money to the
Yeah.
grant and that goes through.
Yeah, and
Okay.
we have had our first grant outside of, or grant application from outside of HSC. So we did receive an application from Iman Schools. So that was really great to see that the different community groups are taking advantage of it and the clubs the word's starting to get out. So
Cool.
it's pretty exciting.
And you still have the 10,000 from
From Jim Hallett,
Jim
yeah.
Hallett from.
Yep, so that's what we're using for those funds right now.
Awesome.
And then if those run out, we still have school
Yeah.
liaison funds that we can support.
It's great.
And then in development, I know we discussed and you guys approved at the last meeting, these mental health training funds. So we're working on that grant process for those. So that would be essentially a small grant program for area mental health providers to be able to get more specialized training to support youth with mental health services. So that was part of the wish list of our HSC schools mental health coordinator, and what she's seeing as a need is some of these more specialized skills to be able to refer people to, because the social workers are at capacity, or maybe they need a special service or training if they're struggling with something more specific. So she would be on that grant committee and is helping us deliver those or consider what those criteria are.
Is there ever a scenario, like I think about our social work program and then our schools are doing at any given time 10 or 20 kids that would be viewed as, I don't want to say threat, but they're at risk, or they may put someone else at risk because they're dealing with some emotional issues. Would we ever directly through our program say, hey, you have impediments to care, like you don't have financial wherewithal to get care, would we ever just give a grant to get those services, or would we always loop it through the schools to provide that?
We could, but because the school has such a robust mechanism in place already, that's the approach we've taken so far. And it's just a lot.
What if like mom or
A
dad
lot
needed
easier to
something or anything
manage.
like that, then maybe we would have the opportunity?
That could be an offer, that could be an option or an offering. Again, we've been taking the lead on, these programs primarily from, what we're hearing from schools on where they're seeing the need. I know that they've asked, about additional ways to support parents in having difficult conversations and parent trainings. So that is kind of on our list of possible community offerings going forward, in that community education space.
Okay.
Yeah. And then just for consideration, some things that we have up, I don't have anything to vote for. I don't think anything is quite well developed enough to have a vote on yet, but I am in several conversations and just trying to figure out where we want to allocate some of that funding for next year. So just as a reminder, a lot of these programs and that expansion Project Hope, for example, is coming from that school liaison funding that we got. It's originated as COVID funds, and it doesn't have a hard deadline on its use. So we've been really trying to be considerate about what kind of things that that would support student health and wellness generally that we could support with that funding. It was meant to support positions as school liaisons. Some health departments had to use it basically to put a nurse in the schools, but we're very fortunate to already have nursing in the schools. So we've really used it to say, how can we extend and augment what they're doing? So one of the things that we had done early on is provide those school nursing association memberships for the school nurses, because the nurses are based out of Community Health Network, but they're not really, haven't been as plugged into the school nursing world and things specific to that. So we can provide those memberships. That also comes with vouchers for vision programs. So they can provide vouchers for students to get glasses if they do those vision screenings and they need glasses. And then we did support some conference attendance for a couple of those nurses to go to the school health nursing conference so they could learn a little bit more about that field. That was something that the schools requested as a need. This funding would support those open gyms. Again, that is not a huge cost, but that's where that funding would come from. Also, again, looking at that nutrition programming with the Ag Park and school nutrition services, we have had several discussions with school nutrition services on different things that we could do. Like, would there be a way to influence the school lunches, whether that be through locally grown produce or some other way? We do have 2 ideas submitted from them that we've been exploring. I'd be interested in your thoughts on those. One is a Flex Farm, which is like a hydroponic gardening kit that could be used to wheel around in classrooms and to educate and then provide some of that produce in the cafeterias. After talking with the Ag Park folks, it sounds like the schools already have some hydroponic kits in the 2nd grade classrooms, and it may be more effective to have a greenhouse. So we're kind of working through that and just seeing, what might come of those discussions. Another proposal that the schools had that I'd be interested in your thoughts on was some vending machines that the cafeterias could prepare foods for. And then they could have like wraps and salads and things in these vending machines that would be only based out of the high schools, offering food for students or the community. The machines that they've proposed are about $20,000 a piece. They're proposing 2 vending machines in each high school. I think they can lock and unlock them at certain times, but they're so expensive because they're weight based. So you once you put your credit card in, and then the whole door opens and then it deducts from your credit card however many things you take. So I'm not sure if that would
we need to
be
be
great for students.
I think we need to be relatively judicious of whatever money we have left in these funds, because, if you read the national narrative and really the state's budget woes, I think whatever gravy train we were on is not gonna be there moving
Agreed.
forward.
Yeah.
So I don't know that I'm not like in a huge rush to go out and spend this. We should really try to find the thing that has the most bang for our buck, because I'm really worried about what's gonna happen both nationally and at the state level when it comes to funding for any of these programs moving forward. And then also, like, even if they start making adjustments at the state level, if they start cutting more and more programs from Medicaid, what does that mean? Do
Right.
those people end up showing up at our
Possibly,
doorstep
yeah,
because
possibly.
they don't have the care that they were getting before? So I think we just need to be prepared for, any inevitability going forward.
Absolutely. I know it's one of the well, at least from the school nutrition standpoint, that's one of the reasons of looping in the ag part and saying, how can we like accentuate a little bit better what we're already doing? Greenhouses cost about the same as one of these vending machines or one of these hydroponic systems.
Get a lot more food.
Yeah, and then another rationale for applying to the grant, because it almost perfectly matches everything that we're doing and what we've been talking about as far as, if we wanted to build a greenhouse, we could use possibly some of these funds for matching, or the Health First Indiana funds for the match requirement. It's 25% match requirement.
When would we know on the grant?
The application is in a couple of weeks.
January 10th.
Okay,
With the federal government shutting down possibly, I don't know if we can base any guidelines or any solid timelines.
I think they said the award would be 6 months after the grant application, so June, July.
Depends on
possibly
whether
if it-
Elon-
yeah.
They said you can't start it
Right.
until after July 1st,
Okay.
whatever it is, but I think it's all of these opportunities have been great excuses, if you will, to communicate with the different partners and really say, how can we accentuate this? When I talk about we need to get into second grade into the curriculum, that's the last grade left. It perfectly aligns with a nutrition class for the kids to really supplement what Brooke's doing out at the ag
Right.
park, because she doesn't really talk about nutrition. She talks about growing, but we can absolutely supplement
Yeah, that
in
makes
that
sense.
area. So we're super excited about where that could go.
Cool.
I mean, just personally, being a grandparent and interacting with Youth Mentoring Initiative, it's either Chicken McNuggets and fries or Five Guys and fries. So, I mean, the more we could do nutrition wise, that would be a personal favorite of mine, especially because, give a kid a fish or teach them to fish, right? Teach them to eat healthy at a young age, and then they eat healthy for the rest of their life. So just my 2 cents.
There is a big growth in these farm to table, not farm to table, what's the word I'm looking for? What's the name of it? Is it farm to table? It is farm to table?
Yeah.
Okay, so somehow I'm on that, but like, it is possible that, that we could get locally grown foods in the schools, right? By coordinating with various local providers, the ag park or many other area farmers. A lot of schools have done this, and you can do it for just one particular commodity, or you can do it for all of those. There are grants available for that. I would love to see something like that. I don't
Start
know.
small, yeah.
I don't know how ready we are for that as a total overhaul, but certainly the ag
We'd have
park.
to give Farmer Trevor.
Farmer Trevor is all for
I know he
it,
is, but that's,
but yes,
You can't work 24 hours a day.
Yeah, that's
Farmer Trevor
we're gonna need
knows that
5,000
he's
tomatoes.
got a lot of expectations on him.
Yes, he does.
So, but I think we'll come up with something to
Yeah.
get somewhere with this.
Mhm.
Another big idea that we had that we haven't been able to figure out how to execute on yet is, the potential of an after-school bus or activity bus, particularly for middle schoolers, to be able to participate in things, because that's where we see kids drop off from a physical activity standpoint and a participation standpoint. The struggle for finding bus drivers is apparently quite real, and so that hasn't gotten any further yet.
Well, Steve's retiring.
Yeah. We
The
could put
coolest
those kids
bus
in
around.
line.
That's right.
Those kids in line. We only need like 4 bus drivers. There's more than 4 of you here.
Nice.
So some other groups that we're talking about just to kind of increase those possibilities, the YMCA and Mudsock Youth Athletics, because those could fall in that area of really focusing on physical education and nutrition for students. So those ideas are still in exploration. We've received a proposal from MUSOC on different things that meet their strategic objectives that kind of align with this. And then the YMCA folks, I think, are putting something together because they have the after-school programming. There may be an option for that instead of after-school buses for middle schoolers. So just exploring some different things. And then from Health First Indiana funding, we budgeted for 2025, $150,000 available. We're having these conversations with Shepherd Center of Hamilton County. They submitted a proposal, Trinity Free Clinic. I have a conversation with them tomorrow about any particular plans for 2025. And then again, YMCA has a lot of fall prevention, like actual exercise classes post-fall. And chronic disease program, something to consider. Again, looking just for the board for any particular agencies I need to make sure to have conversations with going forward as we consider some of this funding.
You know, the fall prevention exercise program, is that something that could be done at home if we taught people or counsel them through it?
So the Stepping On program has a physical therapy component to it with, I think, some chair work. So that's the class that our community health advocate's been trained to offer. It involves pulling together different community partners. As far as some of the teaching from home, there are a couple of other programs that we can add into. The library offers a virtual Tai Chi class, which is one of the very strongly evidence-based physical activity programs for fall prevention. This specific program by the Y is for people who have fallen, which could be just an interesting one to offer. So I'm not aware of what
Well, I
the
think
constraints
there's
are. Yeah, no,
opportunities down
we're
the
just at the
road.
beginning.
Go ahead. Funding be used for, so like in terms of the identified people who have already fallen. I know we talked about this a year ago, but now that there's some funding attached, things like installation of grab bars. You know, if you have like a grab bar or a
We have
restroom, something,
those.
yeah, okay, you've
We
got
have
that.
those and we're implementing those. So, yeah.
42 homes this year.
Fantastic.
Yeah.
Oh, that's great.
I don't know if they install grab bars at everyone, but it's one of the most common usable
It's such
materials.
an inexpensive
Yeah, right.
Yeah.
and wonderful.
Yeah.
I wanted to circle back to the nutrition, because I heard a lot of nutrition, second graders, this and that. What do the menus look like at the high school and the elementary schools?
So.
Can of worms or.
I mean, we're teaching these second
I would
graders the
invite
great
you to take a
nutrition.
tour. I would invite you to take a tour. So we were invited to take a tour of the cafeteria. Unfortunately, the particular date we went was Domino's Pizza Day. And Domino's.
Chicken McNuggets Day, Five Guys Day.
We went to HSC High School.
Nachos Day.
Yeah. Nachos Day is every day. As my freshman is proud to announce, it is my goal that he doesn't have nachos as an option every day. It is his goal to eat nachos every single day of high school. And so far as a freshman, he has done that. But so they have like a nacho bar that's every day. They have a hot meal offering that's every day. I know that the nutrition services is really working to kind of expand exposure to different kinds of vegetables and offerings and things like that. But there are some constant things that they offer, and the high schools do offer a lot more. Like they have chips available for grab. They have ice cream available for grab every day. They have sodas available every day. So we would love to have some support for having those a little bit less easy to grab. And maybe
Just alternatives.
They do have
Yeah.
salads.
They do have
and
salads.
Sandwiches. Like
they do have
chips.
salads and wraps that you can kind of grab and go. They don't have salad bars, and it doesn't sound like they have an interest in trying to attempt those again. They were difficult to manage. They do have fresh fruits available. Yeah. So part of it's the placement, like just what we noticed going through the line and going through the various different components. And there's like multiple cafeterias at each of the high schools. So there's just depending on which cafeteria you go to, you get different offerings and you see different things. But like the chips, the ice cream, the sodas are all right next to the cash register. They're really easy to find. They're front and center. But the reason for that was because otherwise they were getting grabbed and not checked out. So just continuing to have those conversations about placement and what's offered and making sure to highlight some of the more healthy options. I know that they're working really hard to increase the offerings of not only types of fruits and veggies and proteins that are offered, but also like some of the more diverse kind of menu offerings. As our community has diversified, maybe we're trying Indian food and we're trying Greek food and we're trying all the different things.
I would really encourage, I'm not sure if they do it, but to have the amount of calories in each of these things, because it's, when you see that, it's in your face. If I
Right.
go to Five Guys, which I don't, and I'm gonna order a burger and fries, I'm ordering a burger and fries. If I see it's 1,200 calories, now I'm gonna make some decisions.
And they have to calculate all of that, I know, in order to be able to offer the school lunches, because they have very like strict criteria that they have to adhere to. For example, this Domino's Pizza Day, Domino's had to reformulate their pizza to adhere to the standards of the school lunch. And interestingly,
No, taste it. Sorry.
well, they have to use like the whole grain flours and things like that, but the cheese is, I find, the most interesting. In order to meet the standards as a meat substitute for a cheese pizza, they have to double the amount of cheese on the pizza.
Maybe it's pretty good.
What it does result in is really heavy pizzas. So when they're bringing in the quantity that it requires for a high school to host a pizza day, apparently it collapses the boxes and they have a different problem. That's what I learned on my trip.
Yeah. What a disappointment when you get it from Domino's
Yeah.
versus the
So
cafeteria.
then they had to make some kind of new structure to be able to hold the pizzas.
And I
because
think
boxes
the
were
broad
collapsing.
stroke here is, I mean, Monica could go on about this all day, because she has before. I think the bigger issue is you gotta have a willing, like if the school system really wants to take this on, then we could be a great partner, right? It really just depends upon whether you wanna really go tackle this issue and try to come up with creative solutions or not. And that's gonna be that would be the big question, whether the school system wants to try to take this on.
So, and
That decides that, right?
It's a great question. I mean, they have a kind of head of nutrition, I guess.
So some of it is the head of nutrition services, is what's within her capabilities to change and adjust and tweak. So that's who we've been primarily meeting with, and, seeing if we can get any traction on any of these things. That's why we encouraged her to submit some ideas for different things that she might wish to see to improve nutrition among students. That
There's a money
we could
component that plays
potentially
into this for sure.
that we could potentially fund. So the ideas that she submitted again were the hydroponic systems and then the vending machines. But we continue to have meetings with them scheduled to just kind of talk through this. And so your kind of guidance on some of these issues is helpful for us to help guide those discussions.
It'll be interesting if we can get them on board.
Yeah.
That would be my big dream. So I appreciate you guys really diving into the school lunch discussion
Anything else?
so that my
Monica?
kid doesn't get to have nachos every day.
Anything else?
I think that's it.
That's it. Any other questions from the board?
I didn't intend for this to be so lengthy, so
Motion to adjourn.
thank you
Stuff
for
going
your.
on. Oh, Bruce has got a motion to adjourn. Is there a second?